So today I'll discuss a very easy topic, that is the extraocular muscles of eye. So let's first see the extraocular muscles of the eye. So extraocular muscles are 7 in number. That is levator palpebrae superioris, 4 recti, superior rectus, inferior rectus, medial rectus, lateral rectus, and 2 oblique, that is superior oblique and inferior oblique. So 7 in number, 4 recti, 2 oblique, and LPS, that is levator palpebrae superioris. So let's see the muscles in eye and how it is present. So this is the image of an eye, and this is the medial side, that is the nose, and this is the lateral side. So this muscle is present laterally, that is this muscle is present laterally, this muscle laterally most, so it is lateral rectus. Now this muscle is present superiorly, this is superior rectus, and this muscle inferior rectus, and the muscle which comes from here and attached to the eyelid, LPS, and the muscle which pass to the ligament, trochlear ligament, is superior oblique. So let's see another image. Here is the lateral rectus, present most laterally, and this is cut lateral rectus, so we can see the medial rectus. The uppermost muscles which attach to the upper eyelid, levator palpebrae superioris. Then the muscles which crosses the trochlear ligament and bend like this, it is superior oblique. Then the muscles superiorly attached to the sclera, superior rectus. This is the inferior oblique, and inferior muscle, inferior rectus. Let's see the another image here. Here the eyeball is not present, so you can see the side, and this is the temporal side. So this is the temporal side, mean lateral side, that is it is a lateral rectus, it is medial rectus. Here the two muscles, the upper one is levator palpebrae superioris and the lower one is superior rectus. Here is the inferior rectus, and one muscle which originated from here, maxilla, that is it is inferior oblique, and the which crosses the ligament is superior oblique. So let's see the image. Now identify the image on your own, identify the image. So here is the nasal side, this medial side, the temporal side, that is lateral side. So which muscle is present laterally and is inserted here. So what is the name of this muscle? Yes, it is lateral rectus. Now one muscle, number 2, this is the superior rectus. Yes, correct. And one muscle which is cut here, what is the name of this muscle? This is LPS. Another muscle here crosses the trochlear ligament, it is the superior oblique. And the ear muscle, one muscle is seen, what is the name of this muscle? Think. This the name is medial rectus. Now in this picture here you can see a ring. This ring is called common tendinous ring or annulus of Zinn. Let's come to the individual muscles. First on the individual muscles is levator palpebrae superioris. The levator palpebrae superioris is the only muscles involved in the raising the superior eyelid. So it is originated from the lesser wing of the sphenoid bone and immediately above the optic foramen and attaches to the upper eyelid. Action. What is the action of the levator palpebrae superioris? The elevation of the upper eyelid. Levator. Here is elevator of the upper palpebrae superioris. And the nerve supply. So the oculomotor nerve. Then the superior rectus. All the recti are originated from the common tendinous. The superior rectus originated from the common tendinous ring. Inferior rectus is originated from the common tendinous ring. And the action. Superior rectus main action is elevation and inferior rectus is depression. It is supplied by oculomotor nerve. It is also supplied by oculomotor nerve. Then medial rectus. It is goes medially, so it is present medially, and the action is the adducts of the eyeball. That is adduction. That is eye is moving towards the nose. It is origin of common tendinous ring. Easy. Lateral rectus. It is also origin of common tendinous rings and supplied by abducent nerve, and it is the abduction. That is away from the nose. So medial rectus. This is the eye. This is the medial rectus this side. This is the lateral rectus this side. This is the nose. So the medial rectus this side adduction, lateral rectus this side abduction. Then comes the superior oblique. And superior oblique is originated from the sphenoid bone and inserted in the sclera. It is supplied by trochlear nerve. And the action. The superior oblique is a depression. Name is superior, but the action is depression. And inferior oblique is originated from the maxilla. Orbital floor of the maxilla. Action is elevation. It is also named inferior, but the action is elevation. Oculomotor nerve. This is the common tendinous ring. This is the optic foramen and optic nerve, and the superior orbital fissure. So let's see the muscles in a chart manner. It is first that all the rectus, superior rectus, inferior rectus, medial rectus, lateral rectus, all are originated from common tendinous rings and inside the sclera. Very easy. Inside the sclera. All the recti, there is 4 recti originated from common tendinous ring and inside the sclera. Then superior oblique and levator palpebrae superioris. Superior oblique and levator palpebrae superioris originated from sphenoid bone, and inferior oblique originated from maxilla. And the levator palpebrae. Palpebrae means eyelid, so it is inside the upper eyelid, and the superior oblique inferior oblique sclera. So that all the recti are originated from the common tendinous rings, but the superior oblique and LPS are originated from sphenoid bone. So now the nerve supply. So it is the mnemonic of the nerve supply. SO4 LR6 O3. That is superior oblique is supplied by 4th nerve, cranial nerve 4. Lateral rectus is supplied by cranial nerve 6. It is abducent, and other muscles are cranial nerve 3. That is oculomotor nerve. So you can get that superior oblique is 4th nerve. Superior oblique is 4th nerve. Lateral rectus is 6th nerve. Lateral is 6th nerve, and the other all the nerve is 3rd nerve. Now the action of the muscles. So levator palpebrae, elevator. Levator means elevator. So it is the elevation of upper eyelid. Lateral rectus, from the discussion, abduction. That is away from the nose. Medial rectus, adduction. That is towards the nose. So now comes the primary action of the secondary action and tertiary action of the rectus and oblique muscle. So for the superior rectus, it is the primary action is elevation, and inferior rectus primary action is depression. So primarily they cause elevation and depression, but they have a secondary action, that is the superior rectus are introters and inferior rectus are extroters. Introters means this is the eye. Nose. Introters means towards the nose rotation, and extroter means away from the nose rotation. So the mnemonic SIN. The superior muscles are always intortor, that is they cause intorsion. So superior as intorsion, inferior rectus are extorsion. And the superior oblique are primary action and intorsion. The superior intortor and inferior oblique extorsion. But they also causes opposite like rectus, that is superior oblique causes depression and inferior oblique causes elevation. So they both causes elevation and depression. But the catch is superior rectus, inferior rectus, superior oblique, inferior oblique, their primary action are predominant in abducted eye. That is, the eye is position, abduction, and adducted eye means in this position. So superior rectors are elevators in abducted eye, and inferior rectors are elevator depressor in abducted eye, and superior obliques are depression in adducted eye, and inferior oblique elevators in adducted eye. Okay, thank you. See you in the next video.